Welcome back to the program. We're still here on Daybreak Africa, and of course, it's the World Breastfeeding Week. And for us on this program, it's important that we talk about this before the whole week elapses. Now, the importance of this is to put the word out there to encourage women who are lactating, who are expressing milk for their children. This is not just to encourage them, but to also let them know that there are a number of people supporting them. I know there are a lot of myths and a lot of 21st century ideas that maybe may want to nullify breastfeeding and all of that. But we're here to encourage them and tell them that it's their time, and it's what they're doing is not bad. It's what is healthy for themselves and for the baby. Joining us to talk about the World Breastfeeding Week rather, is Nurse Eunice Olurinola. Good morning, Nurse. How are you doing?
Good morning. I am fine, thank you.
Good to have you on the program.
How are you doing too?
I'm very well, thank you. I'm very well, thank you. We're two on the program, so I have Scholastica with me. I know it's an audio interview, so I'm sure you can understand. Now, let's go straight to the topic for today, which is about the World Breastfeeding Week. I've said a lot of things about the World Breastfeeding Week during my introduction, but then the theme for this year talks about blending work and breastfeeding. However, I feel like in Africa here and in Nigeria, that might not necessarily be difficult to do because, for example, in Lagos State, the maternity leave is about 5 months, and you have 5 months long to actually get used to your baby. Then after that, there are nursing rooms, rooms created for nursing mothers to lactate or to express milk for their children. So we're trying to tailor it into the African setting, and that's basically on breastfeeding. And now there are a lot of myths and a lot of unbelief and a lot of lies about breastfeeding. There are women out there who are trying to keep in shape and saying that, oh, I don't want to breastfeed my baby because I don't want my boobs to sag and all of that. Now, generally on breastfeeding, I just want you to give us a few tips that just come to mind generally when it comes to breastfeeding a baby.
Well, breastfeeding is the best thing that can happen to any mother after having their baby. And I don't know how well to reiterate that, because aside the joy of giving birth to a child or bringing a life or giving birth to a living child, the next joyful thing that every mother wants to experience is the joy of breastfeeding your baby. And that is why majorly most patients or clients who does not have the possibility or the capability to breastfeed also feel psychologically disturbed that they could not breastfeed their child. So aside for those who have cosmetic reasons, our socialites, our celebs,
yes.
And I sure feel most of them will also want to breastfeed their babies. So I think breastfeeding is the best that can happen to any mother like someone who has had a child.
Okay.
There's this feeling, there's this love hormone that is released when you breastfeed your baby. So I really find it odd to hear some people say they don't want to breastfeed. If you don't want to feed directly, you can express to feed. But that a baby will not suckle on you or drink from your bosom is something that feels strange to the ears, and that's why we are still sensitizing, we are orientating and enlightening people that breastfeeding is something that we cannot overemphasize. We cannot talk too much about.
Okay.
We'll keep talking about it until everybody gets the benefits that are attached to breastfeeding.
Right.
In cases whereby breastfeeding mothers or mothers who just put to bed.
Sorry, can you be more louder? The second presenter, please.
Okay.
Can you hear me?
Thank you. Yes, clearly now.
In cases whereby mothers who just put to bed are not able to breastfeed their children or their babies due to one reason or the other, probably the baby refused to suckle from her breast, is there an after effect of this action?
On the mother.
Sorry, I want to be sure I heard you correctly.
There are cases whereby mothers who just put to bed are not able to breastfeed their babies.
Okay.
Is there a problem, and is there an after effect to the child or the mother who passes through
due to not breastfeeding the
okay.
child?
Okay. There are several reasons that can cause a mother not to be able to breastfeed. So it is the two factors that will cause us to help us to know the solution before we now talk of whether there's an effect on the child and on the mother.
Okay.
Now, if it is because the mom is not lactating, like maybe the breast has not produced milk, enough for the child, then there are alternatives. But as soon as lactation is established, as soon as breast milk starts being produced, it's encouraged that we put the baby immediately back to breast. Now, if the challenge is not that there is no breast milk, maybe the mom is unfit, maybe for patients or clients rather, that has a cesarean section, and then there's breast milk, but the mother is not fit to breastfeed because she's maybe still on the under the effect of anesthesia. For people who have a cesarean section, we express their breast milk and feed the baby till the mother is capable to handle the baby herself and breastfeed and nurse directly.
What of cases whereby the problem is actually from the child and not the mother?
Okay, like probably the child cannot suckle.
Or the child is refusing to suckle.
Well, a child can refuse to suckle maybe because the child has not taken breast milk.
Okay.
There are children that no child will take breast milk and stop. So the child might not want to suckle, but you can express the milk.
Okay.
Let me tell you a personal experience. My second child didn't suckle, did not directly on my breast.
Wow.
For whatever reason is best known to him. Till now, he's one already.
Wow. So you had to feed in the bottle?
I had to express, and that is what I did throughout the exclusive period. I expressed for 6 months. He even took exclusive for 7 months.
Wow.
Because by the time it was 6 months and I was introducing complementary feed, he wasn't taking it. So I had to continue with the breast milk. So he was on exclusive breastfeeding for 7 months before he had started taking complementary feed. Up till now, my son does not know what to do with my breast.
Okay.
So that's why I laughed.
Okay, I wanted us to talk about.
It did not stop him from taking the breast milk.
Okay.
The message you are passing across with the word breastfeed is that breast milk is the best food for a child from birth to 6 months before you now start introducing complementary feed. And then not a child till like 2 years before you wean the child off breast milk. So that is the message.
Okay.
So whichever ways, either by bottle feeding or by direct nursing, you should breastfeed your child. You should give breast milk.
Okay, thank you. I wanted us to talk about exclusive breastfeeding for a while, but there was something Scholastica mentioned, which is about mothers who are unable to breastfeed. Now, in this would come the role of wet nurses.
Okay.
In all of this, what is the role of a wet nurse? Should it even be encouraged? Because I know that growing up as a child in Nigeria here, in Lagos here, I was told blatantly that it's a taboo. That a child who suckles on another person's mom cannot marry. From my own village, for example, if you suckle from a wet nurse, and let's say the wet nurse has a male child, and I'm female, and I suckled on the wet nurse, I cannot marry her son. It is illegal in my village. So it's like literally like a taboo. So now, what is the place of wet nurses in all of this? Because I know that gradually, slowly, maybe not prominent in Africa or in Nigeria, but slowly people are they're gradually accepting it. Yes. So what do you think about wet nursing?
The wet nurse, let me first tell you, a wet nurse is for people who does not know who a wet nurse is. A wet nurse is a woman who breastfeeds and cares for another person's child as though it's their hers. All right?
Right.
So a wet nurse is employed when the real mom cannot breastfeed, either for cosmetic reasons or for ill health, you know. And I want to emphasize that the wet nurse concept was introduced in, I think, as far back as the 18th century. In fact, I think it's after death, after the death of Christ, when they were still using AD. You know, is an old concept that had been in practice then, and I guess why it was in practice then was because the science had not evolved into producing formulas, you know, that are close substitutes to breast milk.
Oh,
all right?
Right.
And then there is no other thing that you can give to a child except breastfeeding or breast milk. And the child cannot thrive on water.
Right.
Those times, that's why they invented the concept of wet nurse. That was how wet nursing came to be. Do you understand?
Yes.
So it faded off, you know, in the 18th, 19th century. I think to the later part of the 20th century, when, I think 18th century actually, when formulas started coming to be. All right.
Yeah.
So with the advent of formulas, before the advent of formulas, they will use to acquire a wet nurse. They will use someone, maybe a mom that has lost her own child and is still nursing, and then a mom that has EL to not breastfeed. They will not take the child of that person to the other woman to nurse. So that child will not die. At that time, they were having increased mortality rate of infants because of, you know, hunger, starvation, and all of these things. So that's why they brought wet nursing. When we know how something came to be, we will know when the time has, that thing has elapsed its time. Permit me to use that word. All right? When you know why something came to be, when you know why they brought out something, or why did they bring out this thing, why is this thing acceptable at that time? It is because there is no close substitute. All right? So when there is a close substitute, it gradually faded off.
Okay.
And then, you know, this age, our Gen Z, they just want to, you know, they want to think they are weird in their thoughts. You know, if it was accepted then, why can't it be done now?
No.
I guess that's why it is finding its face again in the 21st century. All right, that's why they are trying to introduce it again. What's bad? What's the big deal? You know, what's bad in it? Of course, I'm not saying there's anything bad in it. Breast milk is the best thing you can give to any child.
Right.
But as much as you can give breast milk, things are transmitted also via breast milk. So that is where we should maintain the balance with wet nursing.
Okay, something just came to mind on this wet nursing issue. I just remembered that I saw a video recently in the Guinness World Records page where a lady has been expressing milk for over 9 years. And she supplies this milk.
She's supplying it.
Yes, she's supplying it to. What about that? Isn't that indirect wet nursing?
No, let me explain that.
Okay.
That lady that is supplying breast milk has been subjected to several tests.
Right.
She has been screened, and she's always she's being rescreened.
Yes. I think quarterly.
Let us establish that.
Right.
You know, HIV virus. As much as you can test negative now, you need to retest again in the next 3 months and the next 6 months.
Right.
And this thing is transmitted via breast milk. Hepatitis B virus rather is transmitted via breast milk.
Wow.
You understand?
So these are really dangerous.
These are reasons why we should maintain a balance. As much as I am indifferent with wet nursing, we should also be sure that these breast milk are safe. All right?
Yes.
So if you are employing a wet nurse, before the person will start nursing your child, so the person will be in your radar for a minimum of 6 months. I saw a video on the internet, I think on Instagram, where a lady was breastfeeding I think her niece, you know, because the mom just stepped out. Well, I wouldn't want to pass any comments on anybody's content, but how well how well screened is this person that's doing the work of a wet nurse? All right? So if there is a close substitute, why not go for something that is safe?
Healthier.
And healthier. And if you must employ a wet nurse, please ensure the person is under your radar for a minimum of 6 months.
For close monitoring.
Yes, you have screened for HIV or in several labs, so please. You have screened for hepatitis B. And then there is bonding in breastfeeding.
Right. That's why I was going to get to that part.
There is bonding. When somebody is nursing directly to you, there's this emotion, there's this love that is transmitted. That's why I said earlier that the best thing that can happen to any mother is the joy of breastfeeding. The fact that child is looking directly into your eyes,
right?
And then it's beyond, it's a chemistry beyond words. So you employ somebody to come and nurse on your child for you. Those times, the ADs and all of that, the monarchs, the king's wives and all of these upper class, they might not say they are, when you are not in that particular clothes you cannot wear.
Yes.
So they want to employ a wet nurse because they want to say, in fact, as a matter of fact, breastfeeding makes you return to your pre-pregnancy stage faster.
Really?
Yes, it does.
Wow. I didn't even know that.
Yes, it does. You burn a minimum of, I think, 21 calories. I'm not really too sure right now.
Right.
Per day.
Wow. By
just nursing.
Wow.
So you want to keep in shape. I think the best thing to do is not just hit the gym, but nurse your child. I mean, breastfeed your child.
Okay.
Okay, ma. Can you hear me?
Yeah, clearly. But please use the mic also.
Okay. You said there is joy in breastfeeding your baby.
Yeah.
Okay. How do one, a wet nurse or a nursing mother manage the pain that also comes with breastfeeding?
Yes, because there's a lot of stories about engorgement, cramping in the breasts and all of that.
Nipple.
So yes, and all of that. How do you manage it? Because I'm sure that the level of pain from woman to woman might vary and it might be different.
Well,
so how would one manage it?
Well, breastfeeding should not be painful.
Oh.
Yesterday we went on a sensitization walk, from various health centers. And then we terminated at the market square. What we did majorly was teach the techniques of breastfeeding and proper latching.
Okay.
All right. Now, when latching is when the baby is well applied to the nipple. When latching is not proper, that's when you have the case of cracked nipple or sore nipple.
Wow.
Because the baby is not nursing on the breast well. The nipple, the lips of the baby should not be on the nipple. The lips of the baby should be around the areola.
Oh, okay.
Now, there's a proper positioning of the baby by the nursing mother. So when you are breastfeeding, you don't put the breast to the baby. You put the baby to breast.
Okay.
Now, that is what causes all of these pains you are talking about.
Oh.
A nursing mother can complain of back pain or complain of breast pain. When the mother is taking the breast to the baby, then the mom will sprain her back because you are bending over to nurse your child.
So you have to sit in position and bring the baby to the breast.
Sit up position. The head of the baby will be on your elbow.
Okay.
And your hand will be at the bum of the baby.
Okay.
So with that, the tummy of the baby will be on your own tummy. And the baby will be looking straight into your eyes.
Okay.
With that positioning, there will be no pain like that. When you are nursing your baby. The only pain you can feel is inside your tummy. Especially when you are in your first 6 weeks of post-delivery, because that period, the postpartum period.
Right.
Now that pain is from your womb going back to the pregnancy stage. We call it involution.
Okay.
So involuntary pain is normal when you are nursing.
Okay. Okay.
All right?
Okay.
Pain in your breast is not normal. Now,
Okay.
there are cases of engorgement.
Right.
That is not from breastfeeding. It is when there are ducts that are not open, or maybe your baby is not taking enough breast milk.
Okay.
All right? So in case of engorgement, what we advocate is that we advocate the mom to express the milk and feed the baby. That means the baby is not taking enough.
Okay. Okay.
So when you express, you take mild analgesic like your paracetamol, you should be fine. And then wear firm bra.
Okay. Okay.
All right? So that will prevent the engorgement. Aside that, cracked nipple is for malpositioning.
Okay.
Sore nipple is for malpositioning. And
Okay.
if our audience can take to this teaching of the techniques, proper lashing will be established and the pain will be avoided subsequently.
Thank you so much, Nurse. Our time is very much fast spent, and I really
You are
appreciate,
most welcome.
especially on this note with which we ended the entire program. I will really appreciate you. Thank you so much for joining us today.
Thank
All
you
right,
very, very
viewers, that's how far we can go on the program today. We'll see you guys again tomorrow, same time, same station. My name is Rachael Abioye.
And I am Ambrose Scholastica.
Bye.